I'm Dr. Whitfield, and if you've been waking up more stiff, more tired, a little foggier than you used to be, I want you to know something right away. That is not always just age. A lot of the time, what you're feeling is chronic inflammation, and one of the simplest ways to lower it may already be sitting in your kitchen cabinet: turmeric. Now I know, the moment people hear that word, some of them think, here we go again, another miracle spice, another trendy health promise, another thing that sounds good on the internet and does nothing in real life. I understand that reaction. Honestly, I do. I've been in medicine long enough to see every possible natural remedy get exaggerated, repackaged, and oversold. But turmeric is different in one important way. Behind the hype, there is real physiology, real data, real mechanisms we understand reasonably well. Not perfectly, but well enough to say this with confidence. Turmeric, more specifically its active compound curcumin, can help reduce the kind of low-grade inflammation that wears down the body after 60, after 70, and yes, even at 90. Not overnight, not magically, but meaningfully. And the reason I wanted to make this video is simple. Most people use turmeric in a way that gives them almost none of the benefit. They shake a little powder over food once in a while, or they buy a random supplement, take it for 6 days, then say, didn't do anything. That happens all the time. So today I want to explain what inflammation is really doing inside the aging body, why turmeric matters, how to use it correctly, who needs to be careful with it, and what kind of changes are realistic if you actually stick with it. Let's start here. Inflammation is not bad by itself. In fact, without it, you wouldn't survive. If you cut your hand, inflammation helps bring in immune cells, clear debris, and repair tissue. If a virus gets into your body, inflammation is part of your defense system. You need it. The trouble starts when the system stops knowing when to quiet down. That's chronic inflammation. Low level, persistent, sometimes invisible. It doesn't usually announce itself with a fever or obvious swelling. It just hums in the background, quietly, day after day, month after month, year after year. And after 60, that background hum gets louder in a lot of people. There's a reason for that, actually several. As we get older, the immune system changes. It becomes less precise, a little more reactive in some ways, less efficient in others. Damaged cells accumulate. Sleep often gets worse. Muscle mass drops. Activity levels fall. Blood sugar tends to rise. Body fat, especially around the abdomen, becomes more metabolically active and releases inflammatory signals of its own. Even the gut microbiome changes in ways that can push the body toward a more inflamed state. So no, it's not your imagination if your body feels less forgiving than it used to. I had an older patient once, very dry sense of humor, and he said, "Doctor, I don't bounce anymore. I just dent." I laughed, but I knew exactly what he meant. A bad night of sleep affects him for 2 days. A heavy meal sits poorly. A long walk helps, but overdoing it hurts for longer than it used to. That's often what chronic inflammation feels like in ordinary life. Not dramatic, just a body that recovers more slowly. And this matters because chronic inflammation is tied to so many of the problems people fear most in later life. Joint pain, arthritis, hardening of the arteries, memory decline, insulin resistance, higher risk of type 2 diabetes, fatty liver, some forms of cancer, poor recovery after illness, even skin aging and frailty. Different conditions, yes, but the inflammatory background shows up again and again. That's why a spice like turmeric gets so much attention. Not because it targets one single disease like a sniper. It's because it affects some of the shared inflammatory pathways underneath many of these conditions. Now let me be precise. The main compound in turmeric that gets studied is curcumin. Turmeric contains other compounds too, but curcumin is the one people are usually talking about when they describe anti-inflammatory effects. Curcumin has been shown in research to influence inflammatory signaling molecules, including NF-kappa B, COX-2, and various cytokines such as TNF-alpha and interleukins. You don't need to memorize those names. The practical point is this: curcumin can help turn down inflammatory signaling when that signaling is unnecessarily high. That matters more as we age. Here's the first problem though, and it's a big one. Curcumin is poorly absorbed. That's the sentence most people never hear, or they hear it too late. If you take turmeric in the wrong way, a lot of it passes through you with minimal effect. The body simply doesn't absorb curcumin efficiently on its own. It's rapidly metabolized and eliminated. So if you've tried turmeric before and felt underwhelmed, it may not be because turmeric doesn't work. It may be because your method didn't work. There are a few ways to improve this, and they're not complicated. First, black pepper. Black pepper contains piperine, and piperine can dramatically improve curcumin absorption. This is one of the most useful pairings in nutrition. Tiny change, big difference. Second, fat. Curcumin is fat-soluble, which means it's better absorbed when consumed with fat. Olive oil, avocado, yogurt, whole milk, eggs, even nut butter in some contexts. If you take turmeric powder in hot water with nothing else, you're leaving a lot of potential benefit on the table. Third, regular use. This is where people sabotage themselves. They want the effect of a drug from a food compound. That's usually not how it works. Curcumin tends to be a slow influence, not a dramatic one. It works through repeated exposure over time, gradually reducing inflammatory tone, not by blasting symptoms away in an hour. That doesn't mean it's weak. It means it's different. Actually, let's talk about symptoms, because this is where the conversation gets real. The most common thing people hope turmeric will help with is joint pain. And honestly, that's reasonable. Several studies have shown that curcumin may reduce pain and improve function in people with osteoarthritis, especially knee osteoarthritis. In some trials, the effect has been comparable to certain over-the-counter anti-inflammatory medications for mild to moderate symptoms. Not always, not in everyone, but often enough to take seriously. That's especially relevant for older adults because long-term use of NSAIDs, drugs like ibuprofen or naproxen, can create real problems. Stomach irritation, ulcers, kidney strain, fluid retention, elevated blood pressure, increased cardiovascular risk in some settings. I'm not anti-medication, not at all. Medications save lives every day. But when someone over 70 is taking anti-inflammatories frequently for aches and stiffness, I start thinking very carefully about the trade-offs. Turmeric won't replace pain medicine for everyone. It should not be framed that way. But if a person can safely reduce their inflammatory load and rely a little less on constant pills, that's worth paying attention to. And you know what's interesting? The people who seem to do best are not always the ones with the most dramatic symptoms. Sometimes it's the person who says, "I'm not in agony, I'm just always a little achy." That low-grade, everyday inflammation is exactly the sort of thing turmeric may help with. Now let's move from joints to the heart, because this part is often overlooked. A lot of people still think heart disease is just cholesterol. That's too simple. Cholesterol matters, yes. Blood pressure matters. Blood sugar matters. Smoking matters. But inflammation matters too. Atherosclerosis is not merely fat sticking to a pipe. It's an inflammatory process inside the vessel wall. Plaques become dangerous when they're unstable and inflamed. Curcumin appears to have effects on endothelial function, which is the health of the inner lining of blood vessels. Healthier endothelial function is associated with better vascular flexibility, better circulation, and a lower risk environment overall. It may also modestly influence oxidative stress, which is another piece of the aging puzzle. Again, I need to keep this grounded. Turmeric is not going to clean your arteries in a week. Anyone who says that is selling something. But over time, reducing inflammatory stress in blood vessels is a meaningful goal. It's one of those small edges that matter when added to better sleep, better food, and walking more consistently. Now the brain. This is the area where people get emotional, and I understand why. Many of us have watched a parent, spouse, sibling, or close friend slip into memory loss. Nothing frightens people quite like the idea of losing themselves slowly. I want to be careful here. Turmeric is not a cure for Alzheimer's disease. It is not a shield that guarantees protection from dementia. Medicine simply is not there yet. But chronic inflammation is deeply involved in cognitive decline. Neuroinflammation, inflammation in the brain and nervous system, is a real factor in many degenerative conditions. Curcumin has attracted attention because it may help modulate inflammatory processes in the brain and may reduce oxidative stress as well. Some patients describe the benefit in a way I actually trust more than dramatic claims. They don't say, "My memory came back." They say, "I feel a little clearer," or "I'm not as foggy in the morning," or "I'm not sure if it's this or the better sleep, but I feel steadier." That kind of report doesn't sound flashy, but it often sounds honest. And speaking of sleep, this is where I need to pause for a second because people underestimate how tightly inflammation and sleep are linked. Poor sleep raises inflammatory markers. Inflammation, in turn, can worsen sleep quality. It becomes a loop. If you are sleeping badly, waking up swollen, aching, or unrefreshed, and then trying to fix it with one supplement while ignoring the sleep problem, you're making life harder than it needs to be. A warm turmeric drink in the evening, what people often call golden milk, is not a sedative, but in some people it becomes part of a routine that improves sleep quality indirectly. Warmth, habit, reduced evening snacking, lower sugar intake before bed, all of that can help. Sometimes the ritual matters almost as much as the compound. And before I go further, let me mention something quickly. On my next video, I'm going to break down why hidden inflammation and high blood sugar are so often part of the same problem after 65, and why that combination quietly damages the kidneys long before people notice symptoms. If you want to catch that when it comes out, subscribe. No pressure, just do it if this is the kind of information you like getting in plain English. All right, back to turmeric. Let's talk about blood sugar more directly. Low-grade inflammation contributes to insulin resistance, and insulin resistance feeds inflammation right back. It's a messy cycle. This is one reason abdominal weight gain after menopause or later life can be so metabolically harmful. Fat tissue is not inert. It's active. It sends signals. Some of those signals are inflammatory. Curcumin has shown some promising effects in studies related to insulin sensitivity and metabolic health. I wouldn't use turmeric as a glucose-lowering strategy by itself, but as part of a broader anti-inflammatory pattern, less sugar, more movement, more sleep, better meal timing, it makes sense. I've seen patients become very supplement-focused and very lifestyle blind. They'll ask me if turmeric should be taken at 8 a.m. or 9 a.m., but they're drinking 2 sugary coffees and sleeping 5 hours. You have to keep perspective. Timing matters less than the bigger picture. Then there's the gut. This one is fascinating, and honestly, we're still learning a lot. Chronic inflammation often overlaps with gut disturbance, bloating, irregular digestion, discomfort after processed meals, that sort of thing. In some people, turmeric seems to settle the digestive tract. In others, especially at higher doses, it can cause stomach upset. So this is one of those areas where gentle experimentation matters. Start low. See how you respond. Don't decide on day one that more must be better. In older adults, I usually prefer the boring approach. A small dose taken consistently beats a huge dose taken enthusiastically for 4 days and then abandoned because it caused nausea. Now, who should be careful? This matters a lot. If you are on blood thinners, talk to your physician before taking concentrated curcumin supplements. Turmeric in food is one thing. High-dose extract capsules are another. Curcumin may have mild blood thinning effects, and depending on what else you take, that interaction may matter. If you have gallstones or gallbladder disease, be cautious. Turmeric can stimulate bile flow, which is not always what you want in that situation. If you're prone to kidney stones, especially oxalate stones, discuss turmeric intake with a clinician, particularly if you're using large amounts regularly. If you're preparing for surgery, supplements that affect bleeding risk should always be reviewed ahead of time. And if a product promises miraculous anti-cancer, anti-dementia, anti-aging transformation in one bottle, close the tab and walk away. That's not medicine, that's theater. I'm saying this because I actually like natural tools when they're used honestly. But honesty includes limits. Turmeric is helpful. It is not magic. Now let's make it practical. How can you use it in daily life in a way that is realistic for someone over 60, over 70, even over 80? Option 1 is the food route. This is my favorite starting point because it's simple, inexpensive, and usually well tolerated. Add turmeric to eggs cooked in olive oil with black pepper. Add it to soup. Add it to lentils. Add it to roasted vegetables. Add it to a stew. If you eat rice, a little turmeric and pepper changes the flavor and the color nicely. It doesn't need to become some dramatic health ritual. Just make sure it's paired with fat and black pepper. That's the key. Option 2 is a bedtime drink. Golden milk can be made several ways. Warm milk or a fortified plant milk, turmeric, black pepper, sometimes a pinch of cinnamon, maybe ginger. I would go easy on sweeteners, especially at night. If you need sweetness, keep it minimal. For some people, this becomes a very stable evening habit, and stability matters more than people think. Option 3 is supplementation. This can be useful if someone wants a more standardized intake, especially for joint symptoms. If you choose a supplement, look for one that clearly states the amount of curcuminoids and whether it includes piperine or another absorption-enhancing delivery system. Better formulations are not always the cheapest, but random low-grade capsules often underperform. The dosage in studies varies a lot. That's one reason online advice gets messy. A common range is roughly 500 to 1,000 milligrams of curcuminoids per day, sometimes split into 2 doses. But the exact product matters. A bioavailable formulation at a lower dose may work better than a higher dose of something poorly absorbed. This is also why reading one blog and then taking 3 capsules of whatever was on sale is not a great strategy. Start with the label. Start with caution. Start with your actual medical history. And let me say something else that may sound obvious, but somehow gets lost. If you improve your inflammation and still sit for 11 hours a day, your body will notice that too. Movement is anti-inflammatory. Not punishment level exercise, not heroic exercise. Movement. Walking after meals, standing up more often, light resistance work, gentle stretching for the joints you actually use every day. This is not glamorous, but it works. One of the most anti-inflammatory things an older adult can do is maintain muscle. Muscle is protective. It improves glucose handling, supports balance, reduces frailty, and lowers inflammatory burden indirectly in several ways. I had a patient years ago who kept asking me for the best joint supplement, and finally I said, "I'll tell you, but I'm going to annoy you first." He laughed. I said, "The best supplement in the world won't make up for the fact that your legs are getting weaker." He didn't love hearing that, but 6 months later, after regular walking and basic strength work, he admitted the exercise helped more than anything he bought in a bottle. Sometimes the truth is deeply unsexy. Turmeric works best as part of a pattern. That pattern looks something like this: better sleep, less sugar, more movement, fewer ultra-processed foods, protein that preserves muscle, and 1 or 2 anti-inflammatory supports used consistently. That's the game. Not hacks, not miracles, patterns. Now let me talk about timing because people ask, morning or evening? Honestly, either can work. If turmeric helps you build a healthy breakfast, take it in the morning. If it fits more naturally into a calming evening routine, take it at night. The best time is the time you will actually remember and tolerate. If you're using it specifically for stiffness that is worst in the morning, some people like taking it with dinner or in the evening. If you notice any stomach discomfort at night, move it earlier. Listen to your body, but don't overinterpret one day's reaction. Give it a fair trial. How long should you try it? For inflammation-related issues, I generally think in weeks, not days. 4 weeks is a minimum fair trial if you're using an effective form and taking it consistently. 8 weeks is better. By then, you can usually say whether it's doing something noticeable for your joints, your morning stiffness, your overall aches, maybe even your sense of clarity. And what should you expect? This is important. Expectations decide whether people stick with things. You should not expect fireworks. You should expect maybe a little less stiffness when you first get up. Maybe fewer of those small random aches by the end of the day. Maybe your knees complain less on stairs. Maybe your hands feel looser in the morning. Maybe your body feels slightly less inflamed after a sugary or heavy meal. Maybe your head feels a bit clearer. These are the kinds of wins that matter in real life. Not dramatic enough for television, very meaningful when you live in the body. And yes, even at 90, reducing inflammation still matters. I want to say that clearly because some older viewers think, maybe it's too late for me. It's not too late to lower inflammatory burden. It's not too late to improve comfort. It's not too late to support circulation. It's not too late to walk a little easier. It's not too late to help your body recover better than it did last month. Now, is turmeric enough by itself? No. If your diet is full of refined carbohydrates, processed meat, sugary drinks, and late-night snacking, turmeric is trying to paddle upstream against a strong current. Same if you're chronically stressed and sleeping poorly. It can still help, but it will help more in a body that isn't being attacked from 3 other angles all day long. So if you want the simplest anti-inflammatory plan I can give you, here it is. Use turmeric correctly. Pair it with black pepper and fat. Take it consistently. Walk every day. Protect your sleep. Reduce ultra-processed foods. Keep blood sugar steadier. Build or maintain muscle. That's not a trendy answer. It's a useful one. And I'll add one more thing. Hydration matters more than people realize. Dehydration puts stress on the body, on circulation, on the kidneys, and on how people feel generally. Some older adults are slightly dehydrated most of the time and then interpret the resulting fatigue, headaches, and sluggishness as getting old. Sometimes it is partly that. Sometimes it's not. A little side note here. I had a man once who came in convinced he was becoming seriously ill because he felt weak every afternoon. It turned out he was drinking almost no water, 2 cups of coffee, and eating a tiny breakfast. We corrected the basics and he felt like a different person. Medicine is funny like that. Sometimes the big scary thing is real. Sometimes the body is just asking for common sense. Turmeric fits into that common sense category for me. Not mystical, not silly, just one useful tool. Before I finish, I want to ask you something specific. In the comments, tell me this. Where do you feel inflammation the most right now? Your knees? Your hands? Your back? Your stomach? Your brain as fogginess? I'm genuinely curious what shows up most often for you because it helps me decide what to cover in the next videos. And if you've already tried turmeric, tell me how you used it. In food? In tea? As a supplement? That part matters. So let me leave you with the simple version. If your body feels older than it should, inflammation may be part of the reason. Turmeric can help lower that burden, but only if you use it the right way, with absorption in mind, with patience, with consistency, and with realistic expectations. That's how people actually get results. Not from one dramatic dose, not from hype, from steady use. I'm Dr. Whitfield. Thank you for spending this time with me. If this kind of practical medical guidance helps you make sense of what your body is doing, stay with the channel. I think the next few videos will be especially useful for you. Take care, and I'll see you soon. This video is for informational purposes only and does not replace professional medical advice.